My name is Josephine Lekupe, and I'm excited to share a little bit about what inspired me to pursue nursing, the experience that shaped my decision, and what I have learned along the way. From a young age, I was drawn to the idea of helping people, but I didn't realize the depth of that calling until my grandmother had a car accident 18 years ago. She was trying to cross the road at a busy junction, and she either failed to see the oncoming car or the driver was just speeding carelessly. During her accident and recovery process, I witnessed firsthand the incredible role nurses play in patient care. They weren't just administering medication or checking vitals, they were providing comfort, dignity, and assuring her and all of us hope in that difficult and almost miraculous moment. Because at her age, an accident would have ended her life. But to this date, she's still walking without a walker, but she has dementia. The way they cared not only for her but also for her family showed me that nursing is about compassion as much as it is about clinical skill. It is a way to truly serve others. Recently I had a moment of reflection which really confirmed my decision to fully immerse myself in the nursing journey. I was helping a young gentleman to get his dad in the car for their dialysis appointment. But to this day, his mom was running late and he decided to take him to the dialysis appointment himself. But I realized he was getting a bit anxious because he's never done it by himself. Normally, his mom will come and they will head out together. As I was helping him and assuring him throughout the process, it then suddenly hit me that nursing is just not a job or career. It's people's life we are in charge of, and they have family members looking up to us to give them the best that we can to the best of our abilities and our scopes of practice. The experience shaped my view of patient interaction, the human side of healing, and that healing is more about connection, empathy, and most importantly, being there for someone when they need it most. I listen more now, I observe more, I take my time to understand at the moment mental well-being and reassure them more with positivity and guided optimism. Well, I faced an ethical dilemma when I overheard a conversation between a resident or a patient and her son. She was telling him how she had fall in the bathroom when she went by herself earlier, but she did not report it. Turns out they were in the process of the nurses and his doctor were in the her doctor were in the process of taking out her seizure medication because she had never had a fall or she had never needed she has never had a seizure or needed like the medication was just there and she didn't need it for so long, like that's 10 years. But I was in between respecting her privacy and reporting an unwitnessed incident, but speaking out helped avoid another incident once they took out her medication, because it turns out that she really needs it. That experience taught me the importance of reporting and constant follow-up and supervision to those I care for and those not on my assignment. Because the patients are our responsibility and we are tasked to be observant, alert, and report everything that we see might be of help. Looking back, I think there's more to reporting and what is necessary to report. Some things require judgment and always weighing on who gets to benefit more or lose from my lack of reporting. The moment really helped me understand how ethical reporting and decision making is in nursing. So through these experiences, watching the role of nurses in patient care for my grandmother and helping uh, the a patient and then helping my patient and putting myself in their shoes as uh, as a CNA, navigating ethical decisions and navigating ethical decisions, I've come to appreciate my role in the nursing environment. It's a calling I have finally accepted. It's about between empathy and following routines. It's more about treating every patient as a person and not just as a diagnosis. I believe Bellevue College Nursing Program will give me the foundation I need to grow in both skills and character and prepare me to become who not a nurse who not only who provides not only excellent care but also listens, advocates, and is compassionate to every patient they encounter. Thank you for listening, and I look forward to continue this journey of becoming a nurse through Bellevue College. Thank you.